think about radiation during my cases all the time, even when I'm not doing the cases.
More and more cases are being done by interventionalists, and more complex cases are being done by interventionalists, meaning longer radiation runs.
Radiation exposure is bad. It's associated with a known risk of cancer.
With the articles that are coming out with the physician who got brain cancer.
Glioblastomas on the left side of the brain, where you're facing the eye.
As the cases become complex, I don't worry about it so much just for myself, but I also worry for the patient. Because with long procedures, the risk of radiation burn.
They were going home and seeing that they were like, oh, it's a rash, but actually it's really a burn.
And then the support staff that's actually in the room as well. And they don't really get much in the way of radiation safety at all.
Hybrid rooms haven't been out for that long, and when you're in a hybrid room, there's no rotation. It's not like a cath lab.
Now if I use fluoroscopy from 8 in the morning to 6 or 7 o'clock at night, four or 5 days a week, that's a lot of radiation exposure.
Especially for the CRNAs, they're right at the head of the patient. So we're trying to bring out new ways to help the CRNAs get away from the eye.
We use several different technologies and different modalities and techniques to reduce our amount of contrast as well as our fluoroscopy time.
So I try to limit the amount of contrast in all my patients.
Sometimes it's amazing how a contrast load of just 60 cc's can be a renal threat.
And I do that by utilizing IVUS.
Intravascular ultrasound we've been using quite a bit.
I would not have a venous case done without IVUS. You cannot tell from angiography alone that you have a venous compression.
With arteriography, you really just get sort of a luminogram, and with IVUS, it really sort of tells me what's going on with the plaque, just as if I was doing open surgery.
IVUS is not only saving you radiation, but it's also giving us more information about our patients.
You're going to decrease the amount of radiation that you're exposed to. You're going to decrease the amount of radiation the patient's exposed to. Radiation for everybody in the room. You're going to actually get to see on the inside of the vessel, and you can decrease the amount of contrast.
You can see exactly where you want to be, you can see exactly what you want to do, and that's without contrast, that's without stepping on the fluoroscopy pedal.
We monitor our badges, and especially for the fellows, we've seen a reduction in the amount of radiation they're exposed to, while the number of cases that we're performing is actually increasing.